Security. So a part of HIPAA Act was, besides privacy, was getting into security and really looking at things that are password protected, saying training and procedures updated and done yearly. Started to talk about violations must be reported, disciplinary action, and loss of job, and also the financial implications of this. So now, Congress passed this law, so not only saying you need to protect patients' information, however, you need to have some security measures in place to ensure that you don't have breaches, that people aren't hacking. If we're moving to a world from paper to electronic, again, our vulnerability really went up in this. HIPAA security rule. While the HIPAA privacy rule safeguards protected health information, PHI, the security rule protects a subset of information covered by the privacy rule. The subset of all individual identified health information is covered. Entity creates, receives, maintains, and transmits in electronic form. This information is called Electronic Protected Health Information, or EPHI. The security rule does not apply to PHI transmitted orally or in writing. So the security rule, if you're sending your claims electronically, which you should be doing per the HIPAA rule as of 1998, because again, you got 2 years to get it together, you really start to say, okay, now you need to worry about security. Now anything, paper claims, anything transmitted orally, in writing, maybe a fax, those type of things, a letter, you get a lot less letters from the doctor's office into doctor's offices. Again, most of that is sent electronically. To comply with the security rule, all covered entities must do the following: ensure the confidentiality, integrity, and availability of the electronic protected health information. Detect and safeguard against anticipated threats to security of the information, protect against anticipated impersonal uses or disclosures, and certify compliance by their workforce. So again, anything electronic, even if we're not thinking about healthcare, think of an example like your credit card or your debit card. You try really, really hard to kind of keep it protected. However, there are breaches. Anything electronic is usually over the internet. Thus, there's a high risk involved in this. So this security rule said not only do you have to still maintain confidentiality, you need to really do your due diligence to make sure that nobody can hack you. Nobody can hack your server. What are you doing to protect and make sure that no PHI or no patient's information could be exposed at any point? Well, they started with administrative safeguards. So security management process to implement policies and procedures to prevent, detect, contain, and correct security violations. That means identify ePHI that you create and receive or transmit. Again, a lot of times that's your claims, right? You may be on a computer workstation, laptop, PDAs. Anything that you work out of is electronic most cases. So ensure the security measures are in place. These may be administrative, physical, technical, like locking doors to rooms containing ePHI, password protection of a workstation or file, and by facing monitors away from the public area. The practice should also develop and implement policies that define specific actions when security is violated. This could be sanctions or discipline action against the employee or vendors who don't comply. So again, you really need to look at your risk. If there's a laptop that a doctor might have, or maybe a staff is working at home, you see that a little bit more now with remote working at home, that laptop is now gone from your work, the doctor's office, and it has access to lots of patients' information, medical records, lots of stuff. How is that person going to protect that, whether it's at home or in the office? Is there locking doors? And technically there should be 2 locking doors to get into any type of PHI. So I think this has to be 2 locks. That's the standard rule out there. So doctors' offices really had to start to look at their particular offices, seeing how patients flow. Maybe they went to the back of the office, and when they came back through, they could see a screen of a secretary's. And that's how you start to now, most doctors' offices have, it almost looks like a box, right? You have a box here, and all these different patients are trying to separate it out with walls to protect the privacy of the patients. And they have to really establish that they, again, due diligence, have done this. Workforce security. implement policies and procedures to ensure that all members of its workforce have appropriate access to electronic protected health information and to prevent those workforce members who do not have access from obtaining access to electronic protected health information. Do people, employees, vendors who should have access actually have the appropriate access? Are those who should not prevent them from accessing EPHI? So you're probably wondering, well, if everybody worked at a doctor's office, wouldn't they all need to have access to the PHI? The answer to that is no. Think of your IT folks. They really don't need to get into patient records. There's no good reason. Your facility, your maintenance folks that are in the office, think of your guy who comes in and checks the printer. Those vendors, do they really need to get into medical? They don't. Honestly, besides your doctors, your nurses and medical assistants, your front desk secretaries do need to get into that as well, and your billing staff. Anybody who has a job that is not really directly related to patients' care or processing claims, they really don't need that access. So again, this here rule for HIPAA really made providers and doctors' offices, dentist office, anything like that, really dig deep and say, okay, maybe you did start out working as a secretary. Now you've gotten promoted. You took some IT classes. Now you're an IT guy. We need to change your access because you no longer need to get into medical records. Contingency plan. Establish and implement, as needed, policies and procedures for responding to an emergency or any other occurrence. Example, fire, vandalism, system failure, natural disaster that damages systems that contain electronic protected health information. This would apply to electronic information from sources that should be backed up, such as practice management software, accounting systems, electronic medical records, digital recordings, and diagnostic images. You have electronic testing. Anything really has electronic documents that has a patient's name, date of birth, anything like that really is applicable with this. The information should preferably be backed up to a physically separate location. So that's where you start to look at your systems and your server. Lots of detail went into IT and servers saying, okay, the doctor's going to back up his disk, but he's going to keep the disks at home. So if there was a fire, or even if you think, hurricane or tornado, anything that ran through a doctor's office, we're past the papers all over the place stage, but we need to make sure that we have, the patient's records. We want to make sure that nobody else still can get into those records. Is it locked up? Is it double password protected? You think of all the images diagnostically, MRIs and things like that electronic that are out there. All these different providers had to really tighten up their IT. So they spent a good amount of money working on servers, the backup process, making sure that there wasn't information on servers, if there was a breach or a hack, really tightening it up, as well as looking, like I said, system failure. Natural disasters is the number one. Fire, vandalism, you see a little bit less, but certainly depending on what area of the country you live in, the thing about national disasters is it does happen. Business agreements. A covered entity may permit a business associate to create, receive, maintain, or transmit electronic protected health information on a covered entity behalf only if the covered entity obtains satisfactory assurances from the business associate will appropriately safeguard the information. This would mean having written contracts with providers, vendors that document the compliance with HIPAA security standards. Typically, this would be a software vendors and a billing service. And again, every doctor's office I go into, I have a business agreement. It's pretty ironclad. I like it that way. And it says, you know what, I'm going to treat it. And I also, as safeguard, just as much as that doctor's office should. But also, I need to document where am I as far as security? Am I making sure that my servers are tight? Am I getting my annual training as well? So I also have, as a business associate, I have to provide the same amount of things under the law that the doctor's office do. And again, if you don't have a business agreement, every instance is a giant penalty. And really, there's been a lot of penalties for lack of business agreements. So because they miss them. Oops, I missed the maintenance guy that comes into the office once a month, the cleaning person, anything along that lines who could see a paper, could see a name. What is your risk? They often think about, the guy who houses the medical records and things like that because they think that seems obvious. But It's the little guys they forget, and that's really costly. Facility controls. Implement policies and procedures to limit physical access to electronic information systems and the facility or facilities in which they're housed while ensuring that properly authorized access is allowed. The provider should have means to prevent unauthorized physical access, tampering, and theft of EPHI. This would include locking doors, warning signs, surveillance cameras, alarms, identification numbers, security cables on computers. It also suggests that the practice document specifically how modifications to the facility or building protect EPHI. So I think we talked about at the beginning, you need 2 locks to actually obtain EPHI. So a lot of times it's a badge, and then you have a username and password. Sometimes you have a badge to get on the outside, and then there would be another lock at night for the separate doors to open that specific office. Really, again, this law said you guys have got to tighten it up. 1 lock getting into an office is not good enough. You need to make sure that there's 2 ways to access somebody's medical records or EPHI. And a lot of times password protection, badges. If you go to the ER, your ER doctor comes in, you've been waiting, he probably badges in first to the computer, and then he has a username and password. Then that puts you into your electronic medical records considered EPHI. Workstation controls. Implement policies and procedures that specifically have the proper functions to be performed and the manner in which the functions are to be performed, and the physical attributes of the surrounding of the specific workstation or class of workstation that can access electronic protected health information. This would involve having security measures to protect workstations with EPHI, such as having privacy screens, password protective, screen savers, logging off the workstation when you're not present. So they started to look at individual employees. A lot of times you see like Cubicle World with 3 sides on it. And some people think, well, that's just, they didn't want to pay for an office. That's not true. They want something that has 4 sides. So ideally, nobody can walk by and see the patient's name that you're working on your screen. Besides having obviously usernames and passwords that reset every 30 to 60 days, they also added privacy screens and then added the fact that your computer was on a timer. So if you weren't typing on the computer, then what would happen would be your computer would log off. And sometimes we feel as employees and vendors that it's an annoyance thing. You're talking on the phone to Mrs. Smith, listening to her about her billing problem, or she needs to make an appointment, and you're focusing on her, and lo and behold, now you go to make the appointment, you've been logged off completely, and now you have to say, okay, Mrs. Smith, let me just take a second. My computer has logged me off for security, so I just need to log back in. So we feel like it's a nuisance sometimes, but it's there to protect the provider and the entity, making sure there's no cases that somebody else is working under our name, under our workstation. Say you went to lunch. You don't want somebody else sitting at your desk doing a bunch of stuff or looking at other patients' things when you're not there, but it's under your name. So they wanted to prevent that type of thing from happening. And so they really started to secure down the workstations, who's working, who has access to PHI, and is it protected the best that we can in this type of environment. Device or media controls. So it's implement policies, procedures that govern the receipt and removal of hardware and electronic media that contains electronic protected health information in and out of the facility or the office, and the movement of these items within the facility. So the HIPAA security standard requires destruction of EPHI on equipment or media that is no longer used. An example would be software to erase hard drives when upgrading computers. Other provisions of the standard require creation of a retrievable exact copy of the EPH file before equipment is stored or moved. So not only if that computer's not being used, and a lot of times these are laptops, maybe the laptop no longer is working and it's dead, there's nothing they can do about it. The first thing they have to really think about is like, okay, I just can't toss this in the trash anymore. I need to say what's on it. And if I can't verify that there isn't PHI on there, then I can't really you can't get rid of it. You have to make sure there's no EPHI, because it only takes a really smart person to pull that out of the trash, take it somewhere else, fix it, and then lo and behold, Mrs. Smith's medical records and lab results happen to be on that laptop, and now it's been exposed. Hackers really are targeting healthcare workers for logon to obtain their logon credentials. And almost like the cell phone scenario, we need to really think about hackers are everywhere. Like I said, credit cards, and why do they want healthcare? Are they interested in your going and getting lab work or an MRI? They're not. But what is in your records that they want? Lots of times your social security number, your address, name, date of birth. Then if they can extract that information, then they can sell it out on the market. So a lot of times there are emails and phishing emails that come along that what I consider junk, and a lot of times spam will filter some of that out, but some do get through. So hackers are there to really take down healthcare workers, health insurance companies, the same thing. And a lot of it is therefore it's essential to train staff on to be aware of security. So IT spends a good amount of time trying to train staff, make sure they are aware to look for phishing emails and things like that. One response to an email is all it takes to compromise your whole entire network. So if you are a giant hospital owned, we have multiple locations, many employees, it just takes one click of a phishing email to either infect the whole network or for them to get access and get the username and passwords, and then they can extract tons of information. Basic information should be provided on how to spot a phishing email. And we are going to talk about that just a little bit because it is a part of you being aware to prevent any type of breaches. So how to spot a phishing email. If you've never seen one, for me, they kind of stick out, but I do know that people quickly just click on it and then you got problems. And you get these phishing emails at home as well. I just got one yesterday. It looked like Amazon. It said, oh, there's a problem with your Amazon order. Lo and behold, I knew that I had not ordered anything recently, but it was a way to try to entice me to get me to click, put my username and password in there, and update my debit card and or credit card that I had on there. And then that would expose again my debit credit card. Same thing happens in healthcare. So again, less exposure. So in the email that you have for the phishing email, it requires a disclosure of username and password. That's what they're looking for. They need to get access. Usually it contains a link to an unfamiliar website or just a link. If people don't hover, if you hover over the link, it'll tell you what the website is. A lot of times people will just click on it and then put their username and password in. Its subject usually has exclamation marks. Sometimes there's misspellings and errors. It just doesn't look right. When you go to reply to the email, it also does not get directed back to the recipient. Usually, if you just hover over that email, it may say, Bob Smith at Amazon.com. But once you hover over it, you're going to see it usually has at AXY29, some kind of weird email address. And that's the second case you would say, okay, this is not right. It doesn't say Amazon.com. It doesn't say Anthem.com, BlueCross.com. I'm not going to click it. It explains usually dire consequences. You're not going to get your product, and they use different forms of this. Contains generic greeting messages. Usually has foreign characters, and no contact information is supplied. What does it look like? Well, like I said, as you can see by this example that I've given you, it says from Taylor Brown. That's what it says. But really, when you hovered over it, that's when you got to this webmaster at known vendor. It's going to be something weird. Subject, update your account information. It makes it sound important. Sometimes it'll have banking, Bank of America. Well, if you use Bank of America, you might be quick to click on that real quickly. But if you don't use Bank of America, you might say, oh no, this is fraudulent. This is people phishing. And again, it normally says, it doesn't say dear Mrs. Smith or, Mr. Brown. It says dear member or greetings, hello, something very general. And then at the bottom there it says click on the following link to update your account. Well, if you would have hovered over that, you would have seen that the address that's going to take you is not related to the email or it's not familiar to you. So these phishing emails come not only into your personal email and spam, you've probably seen them. Lots of news on to just avoid them, but they come into healthcare as well. So they're coming into the practice. If they're coming into the practice, a lot of staff think they're safe. Oh, they're legit. How would they get into the practice? How would they know your email? Sometimes they show up in your spam box. So there's something, and this is so important because, again, not just personally for as far as debit and credit cards and your own personal money, but there can be an easy breach. These guys are looking to get access into the system, even get into the server, trying to get access to healthcare records, anything with names and social security numbers on it. Transmission security. So implement technical security measures to guard against unauthorized access to electronic protected health information that is being transmitted over an electronic communications network. Is encryption necessary to protect EPHI information transmitted between the provider's office and an outside organization? If not, what measures are in place to get information such as passwords, protection of documents, or prohibiting transmission of EPHI via email? Well, most of your big doctors' offices and organizations, they encrypt almost everything. And they do have a rule for emails within a doctor's office. So if it does contain PHI, you have to put in the subject of the email CONFMG. And that actually, anytime that's there, the server or whatever they're using for security and things like that, know that it has to be encrypted. It tells the email company that you're using, this has to be encrypted. When it has those words at the top, you're pretty much saying there's EPHI. I'm not a giant fan of emailing anything related to EPHI, such as statements. And many pages, oh, can you fax me a receipt from my health savings? Can you email me maybe a copy of my medical records? I'm not a big fan of that because even once it leaves the building, it's sent over the internet. And, I still believe in let's just pay $1.30, put it in an envelope and mail it and keep the postal workers working. However, everybody wants everything today. So if you want your information today, there's a risk involved because if that's shooting out email, no matter what the doctor does, it's still going across the email from one email carrier to another. A lot of times a work one where it may be, the doctor's office has a pretty tight email system. However, it's going into Gmail, so thus you're exposing it again into Gmail or Yahoo or AOL or whatever you're using for an email server. That information is now been out there to them and is very vulnerable. Access control. So they added into the law that implement technical policies and procedures for electronic information systems that maintain electronic protected health information, access only to those persons or software programs that have been granted access and rights specified in 164.08 and A and 4. That, of course, is specifically in the law where that has there. It also says that each user of the practice management or EPHI system should have a unique identifier, which is a username and password, so the user activity can be tracked or logged in the system to comply with the HIPAA security standard. The standard should also automatically log off users after inactivity to ensure unauthorized users don't have access. So when you look at this part of the law that they put in there, almost, unless that provider's office is on paper, medical records on paper, which is really your small practices, your therapist, social work, that type of thing. Most of your other doctor's offices use a electronic medical record system. And you know that because when you're in the room with them or the medical assistant or nurse, they have their laptop and they are just typing away. That's the big key to you versus a doctor coming in and writing everything down on paper like they used to do in the 70s and some of the 80s. Everything was paper before. So now they're saying, okay, we have this electronic medical record system which has all your information, anything we don't want out there. However, we need to make sure that every single staff member has their own username and password versus shared usage. Back in the 80s, there's lots of shared usage. It would be completely normal for you to cover somebody on phones who was taking phone calls, a front desk secretary, for them just to have somebody sit in their seat, take the calls while they're on lunch, and just use their username and password. Well, that's actually illegal to do that now under the HIPAA Security Act. So they really tightened things up a little bit in making sure they're logging off users, say they went to the bathroom, got their lunch, left their desk, and making sure that nobody has access. And it also makes that staff member accountable. If nobody else has access, your copy of your username and passwords. That's why you never share them. And something happens, you can't really say, oh, it wasn't me. They know it was you because you're the only one that has access, and the computer logs you off automatically after 5 minutes of not using it when you went to lunch. So we know for a fact that nobody else really could have been at your desk. So it gets interesting because it makes staff accountable. So after all that, we say, well, what constitutes a violation? What are we really looking at for violations? Well, Impermissible disclosures of protected health information, PHI. That is really obvious. If you gave out, told somebody something about a patient or somebody else that you shouldn't have and didn't have permission, that's a violation. If you gave the information to the mother of that 16-year-old girl that went to the OBGYN office or father, that's a HIPAA violation. Maybe you told the husband or the boyfriend how the baby was doing, things like that. Or it could be something so simple as, oh yeah, when the doctor saw her last, what prescription did she change? It could be something very, very simple. Just really, if you give disclosure of somebody else's PHI, you've already at the top got a violation there. Unauthorized accessing of PHI. This sometimes happens. You notice that your coworker, Betty Ann, saw the doctor today. She was on the schedule. Or maybe you noticed that your husband, your sister, your mother was coming into the office today and you wanted to know what happened. So you just, hey, I'm just going to take a sneak peek at their medical records and see what the doctor told them today. A lot of times wives will try to do this, sometimes because they feel like their husbands don't tell them all the information. That's a violation. You did not have permission. Even if you were working and you were listed as to disclose it, you should not have just helped yourself and gone into the medical records just because you can. Improper disposal of PHI, that happens quite a bit as well. Sometimes it's anything paper. Somebody puts in the trash versus putting in the shredder, the recycling. Usually there's a box somewhere in the office that's locked up as well that you put anything with PHI on. It could be a laptop, it could be medical x-rays, anything like that. Failure to manage risks in the confidentiality, integrity, and the availability of PHI. So as a supervisor, an owner, management, the doctor, they did not manage the risks. They just assumed everything was all set and did nothing to really do checks and balances to make sure that everything was what I consider nice and tight. There's nobody getting into your server, that type of thing. Failure to implement safeguards to ensure confidentiality, integrity, and availability of PHI. Failure to maintain or monitor PHI access logs. An access log is every time you release information to somebody else, you need to write it down. Patient John Smith, he asked for his records to be sent to his chiropractor, and this is the date, this is what we sent, and there should be a log of everything that's going out of the practice. A lot of practices will just skip the access logs and things like that. Failure to enter into a HIPAA compliant business associate agreement with vendors prior to giving access to PHI. We talked about this is giant. Lots of fines come out of this, and you forget about all the people who have access to PHI within your office. And like I said, it's the maintenance man, the house person who comes in and cleans the office, maybe anybody who could possibly see anything should have a business associate agreement. Failure to provide patients with copies of their PHI upon request. That was into the HIPAA Act as well. If a patient asks for their medical records, you need to give it to them. You cannot delay. You cannot think about it. You cannot charge them, $1 million to get their records. They are entitled to this. I consider 5 days or less to be the standard. 3 days is better. Obviously, if you go into a bigger office, it's going to take them a little bit. However, 5 days is standard. 2 weeks, a month to get your medical records, that's not even cool, and it's a violation. Failure to implement access controls and limits to who can view PHI. This really goes with the next one down. Failure to terminate access rights to PHI when no longer required. Those are your employees that have left, changed jobs. Maybe they're within the same company and they now, like I said, they were a secretary and now they're an IT guy. Somebody should have taken their access away. The disclosure, more PHI that is necessary in a particular task to be performed. This goes back to if that disclosure only authorized Mrs. Smith only wants her records for the last year to be sent, and you sent the whole file, 5 years worth, that's a violation. Remember, minimum necessary. The very least that we can send, that we have permission to send, that's what we're going for. We're not gonna, it's not helpful at all. You might think, oh, I'm gonna send a couple more years or a couple more notes, or maybe I'll send that MRI report. That's not helpful. You're sending more information than what they asked for. Failure to provide HIPAA training and security awareness. Well, that's what we're doing right now. Because believe it or not, if you take Medicare and Medicaid or CVA patients, which is considered federal money, you are required to make sure that all new staff and your vendors and business associates, all of those people get HIPAA training and security training. And then after they're hired, you need to do it every year. And a lot of times offices will do these like one time a year, get everybody done and be done with that. Theft of patients' medical records. Well, you might look at that and say, well, that's not my fault. Well, it is a violation because one, patient's records, if they were stolen, they went somewhere else and they're getting exposed. But the other part is that you as the provider or whoever's managing this healthcare facility, CEO or whoever it is, and it varies per big the organization is, you in due diligence have to have safeguards to protect from theft from happening. So if theft happened, the big question is how? How did someone come into your office, because you're supposed to have 2 locks, and just steal the medical records? How did somebody get into that? So those are questions that you're going to have to answer. And if you had proper things in place and proper procedures, chances of that happening would be super, super, super slim. So that constitutes as a violation, and you are going to get a fine for that, whether it was your fault or not. Also, as we add to it, and some of this we've kind of already talked about, unauthorized release of PHI to individuals. A lot of times that is a phone call coming into the secretary or the nurse. And again, usually it's boyfriend, girlfriend, husband, wife, or even sometimes a daughter who's trying to help her elderly mother get through some bills and trying to figure out when her appointment is. Sometimes, it's not meant or have any intent to be malicious, but the fact is if you released it, you still have a violation. Sharing PHI online or social media without permission. I think if you are putting anything medical or using Facebook Messenger, anything like that, any type of those private messengers with patients, you need to stop doing that. You certainly do not have a business agreement between you, the provider, and Facebook, the company. So obviously we know a lot of things through Facebook or social media. Those, the Facebook company goes through a lot of that. And you certainly don't want to expose anybody's patient's information. And sometimes patients actually start this. They message the doctor and then they tell the doctor, oh, my back hurts, blah, 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 blah. Hey, it's Betty Ann, date of birth, yada, yada, yada. Or maybe they'll message the secretary, which they know personally. They're friends on Facebook, right? Because everybody's all friends on Facebook these days. So everybody's friends. They might think, well, I'm just going to message the secretary. And then the secretary and her having a conversation. Yeah, that's a HIPAA violation. Don't do it. Don't put your personal anything social media with providers in healthcare or dentists. Don't do it. Mishandling and mismailing of PHI. So that is, oops, I forgot to update the address. And I had a letter going to Mrs. Smith. Last time she was in the office, she did not tell us, or we did not confirm the address. And maybe it went to her ex-husband. So now maybe information about visit or test results or PAP results or things like that. I did have a doctor, my personal doctor, sometimes I mail letters and says, hey, your thing was normal, abnormal, please call the office, yada, yada, stuff like that. That stuff there, a lot of this now is going through the portal to stop because paper is very risky. Even from the Postal Service, if something accidentally gets open, now it's been exposed to the postal worker. And there certainly is no business agreement between the doctor and the Postal Service to protect that information. So they're really starting to get away from these paper mismailing, sometimes statements too. Oops, I forgot to update Jimmy Joe. He's now 18 and he lives in Connecticut. He used to live in Georgia with his mom. Now mom and dad, have his statements and things like that. Texting PHI, we talked about this. Don't do it. It's not a great idea. One, it's very vulnerable. We know phones can get hacked. Anybody in your family or friends, or even you taking the bus to work or something, you have your phone, and then they can see the parts of the text message. Failure to encrypt PHI or use alternative equivalent measures to prevent unauthorized access. Again, it's a violation if you did not do your due diligence in making sure as an owner or provider, or even a business associate, insurance, whatnot, making sure that patient's information is not shared or anybody has access to it. Failure to notify an individual or the Office of Civil Rights for a security incident involving PHI within 60 days of the discovery or a breach. So a lot of times, and you'll see little doctors' offices, oh yeah, God, that person, there was a breach or something. We just won't tell anybody. They'll try to keep it a secret. Thing about secrets is a lot of times they get out. So this is sometimes even today when our own debit credit card, it may be like, oh, this company here, X, Y, and Z had a breach, but it happened, 90 days ago, 180 days ago, and you're seeing it on the news for the first time, wondering why you were not told. Why didn't someone say something? That's because they try to keep it a secret, bad press. They want it to get out. If it usually involves just one or two people, they're less likely to call Mrs. Smith and say, oh yeah, by the way, an ex-employee got a hold of your information. Are you okay with that? The patient's going to be like, no, I'm not okay with this whatsoever. What are you doing to correct this? And failing to document compliance efforts. So if you are not doing your training and you are not running a compliance program, and you don't have that documented anywhere, that's a violation as well. We're going to talk about compliance later and what the requirements are. However, pretty much it's a violation, not just if you do it or do something wrong, but if you don't prevent it. And that's really the message. When Congress made this act, they said, you know what, we're not doing enough. We have to be proactive. So we are going to fine and consider violation to any provider, any insurance company, a pharmacy, Walgreens, CVS, any of those. They're all entities. So we're going to really penalize them to try to encourage them to get things done and really tighten down their facility and their PHI. We're now moving on to Module 3, which is MSDS sheets. The first thing you're going to say is, what is an MSDS sheet? Well, it's Material Safety Data Sheet. Now, what it really comes down, materials being chemicals and those type of things that might be at the workplace or the office. And I can tell you every single workplace has some sort of chemical in it. And you may say, no, I don't. I work in healthcare, or maybe I just work at a secretary's office or anything like that. But I can tell you every workplace has something. Safety, that is the safety of your health if something bad would happen and just it gets on your skin, anything like that. Data, that's information that they're pulling about the chemical and how it relates. Will it burn your eyes out? Is this something you just wash out with water, or do you need to go to the hospital? And then a sheet would be a piece of paper, or now you often see these, they were in manuals back in the day. Now you see those moved electronically, and again, you start to see these type of things in an internal internet system, an intranet that works inside. Usually human resources and those type of things are also in that same section. So I want you just to take a moment and think about your workplace. So even if you if you were a secretary, you must have some sort of cleaner to wash down the desks, or anything in healthcare, maybe to sanitize. Even in the bathroom, what do you clean the toilet bowl with? There would be some bleach. Do you have Lysol? Those are all chemicals. So for every single chemical in the workplace, there has to be an MSDS sheet. And that really is for employees if you ingested it, if you got it on your skin, backsplashed into your eye, anything like that. So we're going to start to talk about that a little bit. There's a few requirements that OSHA does require that has to be on every single one. So OSHA says Section 1's got to have identification of the product. Manufacturer, distributor name, address, phone number, emergency phone number, and recommended use. So if you were talking about Lysol or something you use to sanitize the rooms, an aerosol, anything like that, what product is it, what chemical, and really you start to have to get the address, phone number, things like that. Second of all, on Section 2, you have the hazards. So this really includes all hazards regarding chemical, related, into the label and the elements that go with that. 3 is really your composition and your information. What is in this chemical? Is it just one chemical? Is there a bunch of other chemicals mixed together? What is in this? And then you start to get into the trade secret claims as well. 4 is going to be first aid measures, including important symptoms as far as effects, acute, delayed, required treatment. If you got this on your skin, what are you going to do first? Are you going to, again, wash it out? What do I need to do to make sure I don't get hurt by this chemical? Firefighting measures, as far as suitable extinguishing techniques. What if there was a fire and chemicals from the fire? If this blew up, what do I need to do to get out the fire for this? Accidental release measures, so emergency procedures, protective equipment, proper methods of containment and cleanup. What happens if this spills on the floor? Is this an acid? We start to look at those type of things. Section 7, they actually are saying handling and storage. So should this be stored between 30 degrees and 70 degrees? Where is it combustible? Any kind of incompatibilities that go with this. This here for Section 8, this is your exposure controls, personal equipment, listed OSHA's permissible exposure limits, PELs. We also have threshold limits. Any other exposure limited use or recommended by the chemical manufacturer, importer, employer preparing the SDS where available. What type of PPE do you need? Section 9 is going to be the physical and chemical properties listed in the chemical's characteristics. Section 10 is going to be stability and reactivity. List chemical stability and possibly any type of hazardous reactions. If it's mixed with this chemical, what happens? Those type of things. Section 11, this is where you have your toxicology information, routes of exposure, related symptoms, acute, chronic effects, anything related that's toxic on that. So you have section 12, 13, 14, and 15 that are listed there as well. And that's where if it's important or applicable, disposable, transporting, regulatory, anything that's applicable on that, that's where those are going to go. It might say only transport from this to this, thinking propane, or again, chemicals as far as what's in your office. And it varies. You could have carbon dioxide, nitrogen. Think of offices, anything in radiology has some gases and chemicals at the workplace, anything for cleanup. Section 16 is just other basic information, the date of the preparation, last revision. Sometimes in workplaces, they have a bulk of chemicals and then they put it in little spray bottles and things like that. Well, all the spray bottles actually are supposed to be labeled to go with this to really say what's in the chemical, any type of hazards, please, if it gets on your skin, what kind of PPE. So a lot of times is that starts with a big cleaning company who might have bulk chemicals, and then they put it in smaller bottles for employees. Like I said, spray bottles are the number one thing we see out there. And certainly if that employee does not know what's in that, they're spraying, all they know is their employer said, please use this when, cleaning surfaces. They're spraying away, something got in their eye. They don't know what's in that chemical because there's no labels or anything. They have no idea. So this really starts to be procedures to really cut down on those type of events that can happen, like I said, any workplace, whether it's an office, it's outside an office, it could be gases, it could be any type of, cleaning chemicals and things like that. We're going to take one chemical that almost every workplace has, and we're going to look at what the MSDS sheet would look like. As an example, I took Clorox bleach. That's pretty standard. Bleach is standard in many workplaces, much less at home. However, whether every workplace most often has a toilet and those type of things, cleaning the bathroom, disinfecting sinks or anything like that. So many workplaces, whether they're office related or not, has a toilet, so they tend to have Clorox or some type of cleaners underneath the sink. I bet if you go to if you're in your workplace right now, if you go to the bathroom or just start opening some cupboards, cleaners, anything under sink in the kitchen and stuff like that, you're going to find at least one chemical or cleaning agent. But let's take a look and see what this really looks like. So we went with Clorox bleach, so it says other means of identification, none. It's really bleach, and although there's different varieties, this one here we're doing is bleach, and Clorox, it probably all look the same, even your generic brand bleaches. This is the EPA pesticide registration number is right there, the 5813-111. You can see that recommended use would be bleach, obviously. There's uses advertised against. There's no information available. You have the details of the supplier's safety. So you have the Clorox company, you have the address, you have their phone number. In case of emergency, you're going to call the emergency line. So a lot of times that's medical, if not it's transportation related. Under the hazard section, you can say this product is considered hazardous by the 2012 OSHA Hazard Communication Standard. So bleach is hazardous. And again, it's in almost every workplace that I know. You can skin, related to skin, also serious to the eye damage, eye irritation, but mostly, it's going to get on your skin. If it's going to backsplash up, a lot of times it's going to be on your skin, or you might inhale it or something. In the emergency overview you see here, so causes severe skin burns and eye damage. You can see that. The appearance is clear yellow. Physical state's liquid. Odor is bleach. It smells like bleach. They have under precautionary statements and preventions, do not breathe, dust, fume, gas, mist, anything like that. Wash your face and hands exposed. Sometimes if I'm cleaning the bathroom and things like that, I will give it a good bleach and let it sit, but then I open the door later and I've inhaled it in, so I have to open windows to keep the air moving along there. Precautionary statements and response, pretty much immediately call the poison center or a doctor, especially if you ingest it or anything like that. If you get it in your eyes, rinse cautiously with water for several minutes. Remove your contact lenses if present. It's easy to do. Call the poison center or a doctor or physician. You're going to get to the ER. Skin, if it's on your skin or your hair, you're going to take off any clothing that might be contaminated. Rinse your skin in water or shower. Wash up contaminated clothing before reusing it again. And certainly if you inhale it, remove the victim to fresh air. Keep the rest in a position comfortable for breathing. And ingestion, if you decided you wanted to drink it or for somehow it backsplashed up into your mouth, you want to rinse your mouth and do not try to induce vomiting. And spill, just absorb spillage and prevent material damage. So as we start to get into this, as you can see, there's quite a bit of information that comes on an MSDS sheet about all chemicals. And really, if anything happened, we like to assume that nothing will, that we know how to use bleach and cleaner and those type of things. But sometimes they backsplash or things like that happen. Now, looking into section 3 under composition, when we look at bleach, it has the sodium hypochlorite, you have the CAS numbers, you have the weight, and also they have a trade secret, so the exact percentage of concentration they are not putting in there because they consider it a trade secret. If they put that out there, then it could compromise competitors and things like that. So they have the right not to do that. Under first aid measures, you have your general advice, like seek medical attention, obviously, go to the emergency room, the doctor, eye contact, rinse immediately, plenty of water, also under your eyelids, it lasts 15 minutes, keep your eyes wide open while rinsing, don't rub your eyes, seek immediate medical attention. If your skin contact, again, wash your skin with soap and water. Immediate medical attention is required. Wash off immediately your clothing, take your clothes off, and just wash everything with soap and water to get the bleach off your skin. Inhalation, that actually, like I said, that happens quite frequently, even at home. You want to get fresh air. Get that person outside in the fresh air, get them to the ground, just let them just breathe in with really artificial, respiration if you have to. If they're not breathing, if there's difficulty, you obviously want to call a doctor, give them oxygen, those type of things. And you'd want to know if you did have to call a doctor or medical attention and the ambulance came, you'd want to say, you know what, he inhaled bleach for probably like 15 minutes. We were cleaning, we didn't have a window open. Tell them what's going on. Ingestion, again, kind of goes back to, you don't want to drink this, but certainly things do happen, backsplash, so you don't want to induce vomiting. Really just rinse your mouth out immediately, drink plenty of water, never give, anything by mouth to an unconscious person, and call your doctor. Self-protection of the first aider, if you were helping this person, medical personnel, be aware they got bleach on their skin so you don't get it on your skin. Most important symptoms and effects, both acute and delayed, there really is just the burning. You're going to have burning if it's on your skin or it's in your eyes. You're going to feel that burning. You also can see here notices to medical attention. So certainly if you went to the emergency room or saw your doctor and said bleach splashed in my eye, that doctor may go to the MSDS sheet for bleach because it's going to say no supposition, treat symptomatically, product is corrosive material. Use of gastric lavage and really is contradicted. Don't do that. Don't try to induce the vomiting. those type of things. And it's giving notes to the doctor. So these even come as a resource for doctors, especially when chemicals, you're burned by a chemical. What is the chemical? They have to go figure out what's in it. A lot of times burn victims will come in, oh, we got acid on me. What type of acid? What were you doing? And they're going to go try to look at an MSDS sheet to try to figure out how to treat that patient and know what they're dealing with. Now, when it comes to firefighting measures, when it comes to bleach, using extinguishers, measures are appropriate. Use of water spray when fighting the fire might be inefficient. So if there is a fire going on, this product causes eyes to burn, skin, mucous membrane. So really thinking about vapors and kind of specific hazards arising from the chemical. You can also see hazardous combustion products, carbon dioxide. Explosive data, there's really none. Bleach is probably not going to explode. Protective equipment and precautions for firefighters. It's telling you in any fire, wear a self-contained breathing apparatus. Really, you're looking at the vapors and things like that. Protective body gear. Section 6, you have accidental release measures. So here you are, personal precautions, avoid your eyes, corrosive material, those type of things. Refer to protective measures listed in Section 7 and 8. You also start to get any kind of environmental protection and precautions that need to happen as well. You have methods and materials to contain and clean it up. So if there's bleach spill, certainly prevent further leakage. Pick it up and transfer it to a label container. Use sand or something to absorb the material a little bit. You also see that with gas. You ever go to a gas pump station and you see this like cat litter on there, so you're trying to absorb that. You want to absorb up the bleach that goes with this. Handling and storage for safe handling. Well, they're really saying handle in accordance with, good industrial hygiene in workplaces. Obviously, closed systems. A lot of times bleach is in a closet, that type of thing. They're also telling you storage. Keep containers lightly closed in a dry, cool, well-ventilated space. Make sure the cover's on there because the vapors could get out of the bleach bottle. Store locked up. Keep it out of reach of children, obviously. Store from other materials. Incompatible products, strong acids, strong bases, acids, bases, oxidizing agents, those type of things. Section 8, we're seeing exposure and going through that. And as eye washes, eye wash stations, ventilations, things that you need for engineering controls are right on this as well. This is where Section 9, you start to have the physical and chemical properties. This is where you get into flash point, boiling, and that type of thing. Unfortunately, I chose bleach. It doesn't have a lot of physical and chemical properties to go with that. But certainly something as simple as this household ingredient has a lot to go with in this MSDS sheet. It's, when you think of burning and eyes and to be able to treat somebody who has, sucked in the air, the vapors. Stability and reactivity. Again, not a lot going on here. Chemical stability, stable under recommended storage, they're saying. Conditions to avoid. You have exposure to air or moisture over a prolonged period of time. Put the cap on it. Something without a cap is going to travel. Under 11, toxicology information and things like that. Certainly you're back to eye contact, skin contact, ingestion. Has almost the same information we already got at the first few sections. You have your component information minus anything that is trademarked or whatnot. But this is where you start to get into the ins and outs of whatever chemical you have in your office. And there, as we look at hazardous substances, and obviously bleach is one that's in every office in some level, whether it's bathroom cleaner or something. I wanted to drive that point that there's a chemical in every single office, no matter where you work. Right here is the list of what they consider the toxic and hazardous substances. So all these as well would have MSDS sheets, cleanup, those kind of things are more detailed, obviously. Let's even just looking at asbestos or lead, the cleanup and the hazards are more significant, obviously, than a container of bleach. On the left-hand side, there's your policy numbers where you're going to go if you did have some lead that, you were working on a building or you were in an office that you notice that you think has lead. It's going to take, that owner to say, how do I get rid of the lead? What do I need to do? And this is where you get that standard number. So I chose, again, asbestos because most people know what that is. They know it's dangerous. You can see it's got your policy and your standard number, the 1915.1001. It's got a part number on there, subparts. They have this as toxic and hazardous, obviously. You have your GPO sources and standard number. Once I go into that, and all this information is available right at that OSHA website we talked about, it breaks it down. As you can see, demolition, you got removal, construction, installation, any type of cleanup that you need to do. And it really lists how to carefully, procedures that you need to do. So if you're going into asbestos and you want to remove it, well, how do I do that? And what protective equipment do I need? What resources do you have? Well, this is how they have all this standardized instruction at your fingertips. If it's not at your workplace and you're dealing with this every day, like I said, I chose asbestos, but it could be lead or anything else. It's going to be able to show you how you can do the job you need to do, either remove it, cleaning up after it, any kind of emergency spill. All right, so like here we are. We're moving on to sexual harassment. We're going to dig deep, and this is module 2. So unwelcome verbal, visual, or physical contact of a sexual nature that is severe or persuasive and affects working conditions or creates a hostile work environment. Just looking at this picture right here, you can see a female. There's 2 gentlemen. Obviously, in their defense, we don't know what they're thinking at this time. However, they appear to be looking at her backside. And maybe they're having a conversation about it. We don't know. We don't know if she overhears it or somebody else sees it. But these are the type, it doesn't have to be verbal. It doesn't have to be physical. It can be a visual scenario, looking somebody up and down, the elevator eyes thing. Those are all examples of harassment. The first thing of sexual harassment is, conduct is not sexual harassment if it is welcome. So the first thing you need to do is say stop. For this reason, it's important to communicate verbally or in writing, I like writing, to the harasser that makes the conduct, that tell them it makes you feel uncomfortable and you want them to stop. So the very first thing to even be considered sexual harassment in that nature is it has to be unwelcome. It couldn't be a scenario where your boss is asking you out a couple times, you want to go to dinner, you're single, he's single, you say, sure, I'd love to. That's not really sexual harassment at this point. It can turn into it later if the relationship doesn't work out or whatever. We will see cases that it continued on, that it may be sexual harassment, but the first thing you need to know is you have to tell the person who's harassing you it's unwelcome. I'm sorry, thank you very much. I'm married, I'm not interested. Please stop this behavior. It's making me feel uncomfortable. Now, we're going to kind of look at some examples of sexual harassment in the workplace and then some non-sexual harassment. So it's not considered sexual harassment. Maybe it's regular harassment, hostile environment. It may fit another criteria, but here's the difference. So under the sexual harassment side here, you can see sharing sexually inappropriate images or videos. So they're sexual of nature. Sex is related to it, and you're sharing it on your phone, on your computer screen, you brought in a picture, anything like that. You also can send suggestive letters, notes, or emails, making inappropriate sexual gestures, and just inappropriate touching, fondling, those type of things. Now, for it to be a non-sexual harassment, in the work, you're really using racist slang, phrases. It's not related specifically to a sexual nature. Maybe what they're saying, or they're showing you a picture of just really inappropriate images, but they're not of a sexual nature. Wearing clothing that could be offensive to a particular ethnic group, that's really called other types of harassment in the workplace. Making negative comments about the employee's personal religious beliefs. Again, those are not sexual harassment. So there is, as we start to look at sexual harassment and what are the qualifications that go with that, it has to be of a sexual nature. If it's something else, then we start to look at other types of harassment in the workplace. We need to think about intent versus impact. So how do you know if your comments or actions are unwanted or unwelcome? You can kind of test yourself by asking these questions. Is there an equal power between me and the person I'm interacting with? Are you guys of the same level, the same title? Or is this a supervisor management that's harassing someone who is in a lower level than them? Somebody, entry level position, a secretary, male worker, or anything like that. So ask yourself where the power is. Is there an equal initiative and participation between me and the person that I'm interacting with? This goes back to welcome or non-welcome. Is that person saying, yes, I'd love to go to dinner with you? Or if you put your hand on their shoulder, are they saying, oh, please continue to do that? That feels good. There's a difference there. And you ask yourself, would I behave in the same way if this person I'm in a relationship with were standing next to me? So if your wife was next to you, would you still be having this behavior? If this was your mother, would you still, that was the person, would you still have that behavior? So ask yourself those type of questions to really keep yourself in check. Would I also want someone else to act this way towards that I'm in a relationship with? So if you're a spouse, would you want someone else treating them like that? Would I want any of those behaviors to be a subject of a column of my agency's newsletter or to appear on the evening news? Is it okay for you to, touch your employee's or secretary's shoulder or backside or any of those? Have I examined and acknowledged my sex role stereotypes? Now, as we get into this, we start to look and say, in this case here, you have the shoulder. So you have, and again, we don't know what was said, if anything. All we can go by of this picture is what appears to be maybe a boss putting his hand on this particular person's shoulder. Now, as we can see, she is not smiling. It doesn't appear to me that she is welcoming this type of behavior. And anything like that. So, and he can't see her face. So in this picture here, you don't really know if you are the harasser and you're putting your hand gently on somebody's shoulder. You don't know their face, their facial expressions to even know if they're okay with it or not. Hopefully this person takes her hand and removes the hand from the shoulder. And just says, can you not do that, please? It makes me feel uncomfortable. Because that would be the first step, is just saying no. Maybe she's worried about losing her job. And lots of other factors go with it. Again, we don't know what this person is thinking. And certainly the harasser or the manager or the boss with the hand on the shoulder, he can't see her expressions as well. So it could be innocent. I will say that. I did have an employer that I worked with who did once put their hand on my shoulder. It was more like a hey buddy, what's going on kind of thing, like a slap almost. Worked for that person for a long time, and that did happen. I personally wasn't offended by that one instance, and he never actually did it again in that scenario for me as well. So, but if he had done it again, I might have said, hey, I'm not comfortable, I'm not a touchy person, can you not do that? And and I'm sure that that would have worked out. When we look at harassment and sexual harassment, they kind of break it down. So really, a quid pro quo harassment is this for that. That's your most common scenario of sexual harassment. You also can get into the hostile work environment harassment, which I'm sure many of you have heard for before. But when it comes to sexual harassment usually it's this for that. A lot of times, too, it's people that are in power. Under quid pro quo harassment, generally resulting in tangible employment decisions based upon the employee's acceptance or rejection of unwelcome sexual advances or requests for sexual favors, but it can also result from unwelcome conduct in a religious nature. This type of harassment is generally committed by someone who can effectively make or recommend formal employment decisions, determinations as far as termination, demotions, denials of promotions, raises that will impact the victim. And like I said, most of it is manager, supervisor is doing the harassing. It is not someone on the equal level as you. It has to be somebody of power. So an example would be supervisor who fires or denies promotion to a subordinate for refusing to be sexually cooperative. A supervisor requires a subordinate to participate in a religious activity as a condition of an employment. Sometimes you see that in southern states usually, or rural states. Supervisor offers preferential treatment or promotion for subordinate sexually cooperative or joins into the supervisor's religion. So quid pro quo, it doesn't have to be sexual harassment. It can be related to religious, but when it comes to sexual harassment, most cases it is quid pro quo. Certainly asking you for dates, sexually favors, I'll give you a raise, you'll get a promotion, you'll get your own office, more hours, things like that of that nature. Now, we talked about the conduct of the harasser must be either severe or persuasive to be classified as sexual harassment. Although a single unwanted request for a date or one sexually suggestive comment might offend you and might be inappropriate, it may not be sexual harassment. However, a number of relatively minor separate incidents may add up to a sexual harassment case if the incidents affect your work environment. So again, my ex-boss put his hand on my shoulder one time. He meant it as a buddy thing. He never did it ever again. So one and done, you probably do not have a sexual harassment case. Normally it's over a period of time. So if it happens once and then it happens again, you may start taking notes and those type of things to see frequently how often it's happening, what kind of interaction is going on verbally or physically. Verbal examples that you might find for sexual harassment is referring to an adult as girl, boy, hunk, doll, babe, and honey. I can tell you right from this first one, it took me a really long time. Sometimes, younger people or elder people, I might, as not really sexual, say, it's okay, hun, I've got this for you. I certainly wouldn't call anybody babe or boy or a hunk or anything like that. However, I have said hun, in some kind of passing. Certainly didn't mean to offend anybody, but as I received my own training in sexual harassment, I curved that type of behavior. And that's what we want to do today, is really curb some of these behaviors. Whistling at someone, making a cat call, making sexual comments about a person's body, making sexual comments or innuendos, turning work discussions into sexual topics, telling sexual jokes and stories, asking about sexual fantasies, preferences, or that type of history, sexual history. I always tell people that sometimes you work in an environment for people for a long period of time, you become comfortable. It may be comfortable over lunch to pass a joke or a story to a coworker you've worked through for 5 or 10 years. You might think that's okay. However, it's Mrs. Smith who's overhearing that. She could be offended as well. Or that person you're having that joke with, they might not think it's appropriate in the workplace as well. Nonverbal examples, looking somebody up and down, that's the elevator eyes, staring at someone, blocking a person's path, usually with your body, following the person, giving personal gifts, displaying sexually suggestive visuals, so there might be some posters or something in your office, making facial expressions such as winking, throwing kisses, licking the lips, making sexual gestures with hands or through body movements. Those type of things would be nonverbal examples of harassment.